Hello.
Oh my God, it actually worked really well. So we're a minute early
Oh, there
now, but anyway.
we go.
And what I was going to do in the time of waiting for you to join was big you up, really, and talk about
Right,
you. How
thanks.
about that?
I actually bought tea, so big me up while
Okay.
I drink my tea.
Well, first of all, it's International Women's Day
Is
tomorrow,
it?
so we need to talk about that. Yeah, I mean,
Nice.
I did a networking thing yesterday, and we were all talking about
Oh,
how
I saw
great
that on
us
your
women are. So
stories.
yeah, so I think
Were they all
um,
local people?
yeah, yeah, which
Oh,
is nice,
good.
and all women. So it's really
Nice.
quite a nice little thing to do if we have time. Yeah, it's really good.
Nice.
Um, so this is Ellie. I want to introduce you. Ellie by Aesthetics. Now we've been doing aesthetics around the same amount of time.
Yeah.
We were both very nervous when we started, weren't we? What was it?
We were
four
so
years ago
nervous.
now. 4 years
Mm.
ago, and
Yeah.
we're both paramedics. Boop boop
Yeah.
boop. Prescribing paramedics now. Now,
I
what a
know.
journey that's been, eh?
Well, I think since I'm not in the ambulance service anymore, Ben keeps telling people I'm not a paramedic anymore, and I'm like, I am a paramedic
Yeah,
still.
yeah. It doesn't. It's in your core. It's like
I know.
we wouldn't be doing what
He
we're doing if
introduced.
we hadn't been paramedics, would we?
No,
You know?
no
Yeah,
way.
yeah.
And honestly, I introduced myself to somebody at work's Christmas party, and they said, "What did you do?" And I said, "I'm a paramedic." He was like, "No, you're not." I was like, "Yes, I am."
Yeah, it's crazy,
Yeah.
isn't it? And then when I say I am a paramedic as well, I notice people go, "Oh, you're still doing it then?" And I'm like, "Well,
I'm just
yeah."
doing a different
Just
paramedic
do it.
thing.
Yeah,
Yeah.
yeah.
Yeah. Yeah.
I was talking to someone this morning actually, and they were, saying paramedics are so well placed because we don't panic if something happened or something went wrong. We've got all the kit. We know what to do. We could, I mean, even someone else was talking about how, well, why don't you start actually training your paramedic, that sort of life-saving stuff
Yeah.
as well as within like the
Yeah. Yeah.
complications care and stuff. And like, oh, that's a little idea. But anyway,
I
not
did.
now.
I did have a complication this week, and it properly brought back that right, think. What am I going to do? And you know when
Yeah,
it brings back all those feelings of like being on the road and having to be in control of something,
yeah.
and you're like, and
But
breathe.
no panicking. Yeah, I mean that's what we're expert
Yeah.
at. At the end of the day, if you don't panic, you can think
No.
clearly, and it also it portrays onto the patient, especially. I mean, obviously, if you're doing cardiac arrest, they're not really aware. But in what we're doing now, if something did go wrong, we're still calm and
Yeah.
able to explain clearly because we're great communicators. And all that is so much better
Yeah.
than.
Yeah.
We're just good at that, aren't we? Yeah.
Absolutely.
Our bread and
Yeah.
butter. So we're going to talk about exosomes and
Do you know,
polynucleotides. We've
I
both been doing
actually,
polynucleotides, haven't we, for a while now?
well, before we came on, I actually thought I'm going to look up actually what because we all say regenerative medicine all the time. And I was like, I'm going to have a look and see what that actually means. So it says regenerative medicine focuses on harnessing the body's natural ability to heal and regenerate tissue. So rather than putting something in you like Botox fillers, which actually I think a lot of people are moving away from, they don't want stuff put inside them anymore.
Yeah.
They actually want the body to do its thing. And I thought that was a really nice definition for patients to see what is the difference between polynucleotides, exosomes, and Botox filler, which really were the only two that people knew what they were up until, well, I think still do, really.
Yeah. Yeah, and I mean, there's still a place for them, but
Yeah,
if someone
sure.
wants to have, combination treatments and depending on what they look like and stuff and their age and, when they started their journey within the aesthetics field as well. But yeah, I mean, we brandish regenerative medicine and longevity as a thing now, but actually understanding what it is exactly what you just said, isn't it?
Yeah.
It's
making your body do the work that it used to do rather than us giving it something. Yeah.
Yeah. So do you want to explain what what you understand as polynucleotides actually does within the skin?
Yeah, so I do polynucleotides in clinic. I don't actually do exosomes yet, so that's great. So you can do exosomes after. So polynucleotides actually work on the fibroblasts, which sit inside the dermis, which is that layer underneath this one we can see. And they increase production of collagen, elastin, they increase the hydration in our skin. And the polynucleotides basically go in and tell the fibroblasts to work faster, work harder, and do what they used to do when we were younger. So whenever I have somebody that I come in and I'm talking about polynucleotides to, I always say we're asking your body to do something it used to do. So it's not always as reliable in its results. So I can say to somebody, if I put 2 mils of filler in your cheek, you're going to look lifted there. Whereas with polynucleotides, we are asking your body to do something. So it's not quite as easy to tell you exactly what you're going to get from that, but it will improve, you know, skin quality, skin glow, pore size. It will smooth your skin. It will improve your elasticity. And we can use it on other things too. So scar repair, wound repair, just generally repairing the skin itself. Hair, yeah, hair. I haven't used it on hair, but yeah, you're doing somebody at the moment, aren't you, that you're using it on the hair?
No, I'm not. I'm doing. So I've got a lady who's doing Exosome face, but I'm not doing hair at the moment. But I've just been learning loads about what both polynucleotides and exosomes does on hair.
Yeah.
So I'm really, really, really excited to be offering that now. And I've got a really like quite exhaustive information sheet on my website now. So because I really want to get more men. I'd really love more men to be coming as well.
There's definitely more and more men coming through the clinic doors. I'm doing lots more, you know, male both. They want to look after their skin, and I think this is actually a prime way of doing it, because we're saying to them, you know, we're encouraging your body to do it. We're not putting Botox and filler in you. I think it's a really safe way of doing it, and a way that people, they want those results. But I always have to kind of sell it to people as this is a real investment in your skin. Because we're going to do a couple of treatments. We're going to do them 3 to 4 weeks apart, and you won't see, it's not like your Botox where you've got those wow results in a couple of weeks. Like you're really using this money to invest in your skin, and that people actually, the results afterwards, they're so natural looking, and people do love the results. But I think it's wrapping your head around what you're having.
And I mean, I do find myself saying all the time, like, you've really got to have, like, obviously depending on age, 2 treatments 4 weeks apart or 3 weeks apart, maybe more on the hair, but you've got to be patient. But the more you have it, the more it continues to work within the skin, and the better it gets, doesn't it? I've been having polynucleotides now for about over a year, and I've only just started on the eye though, so don't look at my eyes. And I love it because it just feels more robust.
All lower face?
All here, but your skin just feels more robust, and it's weird. It's good. I love it.
They sting though, don't they?
Yes.
They do. But we will numb you. We'll numb you well. But it's the product. It's not the injection. It's the product itself.
It's the product itself. Yeah. And in a way, you know, it's like when you've been for a long run and you ache the next day. I mean, it's that, oh, that's good, I know it's working.
It's working.
I feel like it's the same with polynucleotides. Yeah, it was worth the stinging because I know that's the product is going to really work. And that it's pure and not mixed with, you know, I mean, I know being mixed with lidocaine and stuff is not so bad, and depending on the product, but the evidence needs to be there to know that it's safe. But it's good to mix with that.
I've never needed to put lidocaine in.
Sorry?
I've never needed to put lidocaine in. Everybody has. They've been like, oh, that's stingy, but they've got there.
Yeah. But I mean, when they mix, like a lot of fillers are mixed with lidocaine, and that is still okay within the filler. Doesn't react with the molecule. You know, it's and polynucleotides in its base that we're using it is still a fairly early product, isn't it? So they you know, they haven't done the evidence to know whether it's safe to mix with lidocaine. That's the point.
Go on then, so, tell us about exosomes instead. So what
are
the difference? Okay.
So obviously it's a cutting edge technology like polynucleotides, and it works really well both with hair and face. So it's tiny little vesicles. Exosomes are tiny little growth factor vesicles that they deliver growth factors that signal molecules. So a little bit, very similar. That's why it's still a regenerative medicine to polynucleotides, but it's microneedled into the skin. And again, it signals the vesicles to go. You can imagine these little molecules going, oh, where, and then they grab on to the vesicles that they find that they need to grab onto, and then make them work better and harder and more, and hence you get the and it helps, so that produces more collagen, more elastin, and nice smooth looking. It's
for the people who don't want injectables,
it's an excellent, yeah. It's really an excellent alternative, and very similar to polynucleotides. You need 2 or 3 treatments, and then one every 5 to 6 months. Or when you feel, oh, it's coming, my crepiness is coming back again. Can I have another one? You know, so it's very much. And that's what I love about the regenerative medicine anyway, is that, you know, it's the journey. They come, you know, to me. You can have another little relook and go, oh, you're looking good, and you know, maybe we should do a bit of this, or what do you feel about this, and how are you feeling about you? Oh, you've lost weight. Oh, you've put weight on. Well, let's have a talk about that. Oh, how's, you know, menopause and things. And I just really love all that, getting into all that. And Exosome, I think, fits into that nicely.
Is it any quicker than polynucleotides to see results?
Yes, I believe so. You can get like my patient I had recently, she was like, oh, a bit itchy. Sometimes I have a little bit of hay fever. Is it that, or do you think it's the? And then so I looked it up. Actually, you can get a little bit of itching when your skin is, especially if your skin has had nothing and you're kind of on the beginning of the journey and you're doing some combination treatments, but you've just had the first exosome. Your skin's like really working hard straight away. So I haven't really seen her since this one that I'm talking about since, but you know, I think she's really happy, and I'm looking forward to the journey within all that. So it's good.
And I think the other question that most commonly I get asked is, are they safe? And actually, they've got a really, so again, I can only talk about from polynucleotides, but a really good safety profile. They've been used in other areas of the NHS, burns repairs and things, before they moved into aesthetics. So they are safe. You're very unlikely to have any kind of allergic reaction to them, just because of their safety profile. So they're really good for people who feel a bit nervous about side effects and things like that. They actually have very few side effects too.
And with exosomes, listen, that's the main reason I think that they're being microneedled rather than injected, because there is some ongoing evidence-based research going on out there to see what would be safe and what size molecule. And remember, it's a very tiny, they're vesicles. That means they're much smaller molecules than the polynucleotides. So you get a better effect with it being microneedled, and it's much quicker at the resurfacing look. You know, that's why I think the polynucleotide and exosome combination is such a winning thing, because you're going to really get that smoothness, and then, you know, the longevity side of the health and quality of the whole face is going to be top notch.
So other than, obviously, these are the two that we're going to talk about today, but I was just kind of looking at the other areas of regenerative medicine that people might have heard of. So stem cell therapy, PRP was a big talking point for a while. That all comes under regenerative medicine. And then the energy devices, which neither of us have an energy device, do we? But lasers, HIFU, IPL, they again are all regenerative, making our body do its work again. So any of those things that you might have heard of all come under that bracket. So when you hear the words regenerative medicine, it covers all of these different types of things.
I had someone call me today actually about she said, do you do CO2 laser?
Okay.
Well, no, I don't, but I did try, you know, say, well, what is the difference? You know, I mean, the difference between having something laser is a bit more, you know, it's a bit more invasive, so you're going to have a bit more downtime with it. It, you know, it might work well if you choose the right laser, etc. I don't know enough about it to tell you which ones would be good or not. You just got to bear that in mind, because a lot of people that come to me, you know, they want to be able to go away 2 days later or go back to work the next day, or, you know, so they're all, every single patient is always like, when's it going to be okay? When's it going to look nice? You know.
That's it, because actually we've all got busy lives. And actually some people don't mind rocking a bruise and a blebby thing from an injectable, and actually some people are quite no, actually, I don't want to tell people about this. I don't want people to know I'm having treatment.
Yeah,
which is fair enough.
Yeah. And then it's just down to timing, isn't it? There's sometimes they go, oh no, don't. But yeah, PRP is an interesting one because I'd kind of love to do that, but you know, you got to have the centrifuge. You need to be you got to be CQC, and because you're, you know, taking raw blood from people and then taking the plasma out and stuff. But I mean, as a paramedic, and you're probably the same, I quite like the idea of it. But,
yeah, definitely.
Feels like a natural thing to offer, but we'll see maybe in the future.
I've got such a tiny little room here that actually I would love a laser machine. Just finding space to put it all in.
Yeah, but from our perspective though as well, having polynucleotides and exosomes has been amazing, because we wouldn't have been able to really have that much.
And polynucleotides are my go-to for under eyes now.
Yeah.
I barely recommend anything else.
Yeah. You know,
I've
used hydro boosters a bit and stuff like that, and I've found that boosters are really good for back of hand as well. But it depends, you know, on the patient, of course. Yeah.
Nice. Well, thanks for inviting me to do my first ever live. It wasn't as bad as I thought it would be.
That's because it was with me, darling. You know.
I know.
I know.
And we'll have to get some good before and afters of polynucleotides that we can kind of show people. And
And well,
your exosomes, I'd love.
It's really it is hard. It is hard to get a good polynucleotide before and after.
It is, because it's all about the feel and the integrity.
That's why I kind of talk about myself, because I'm like, you know, I can talk from experience, but I should have taken better photos. But it's I'm saying you've got the really little clinic, and I don't know what you're set up for photos, but I'm it's secondary.
I could be significantly better.
Sorry,
I could be a lot better.
Yeah. Anyway. Thank you very much for your time. Enjoy the rest of your cup of tea. And
Thank you. I've got one more client and then clinic's done. So
Hey. All right. See you later.
See you later. Bye.